Sinus drainage technique. As with all drainage techniques, we first start by releasing Sibson's fascia. This technique is usually performed with the pad of the index fingers. We will start just inferior to the eyebrow on the medial third, palpating for a sense of fullness, often perceived as a bony prominence just under the eyebrow. This is often found on the affected side. Once found, we will balance the left and the right, matching tensions bilaterally in this area. We will hold here until we feel a change in the tension. Once complete, we will then move to just above the eyebrow at approximately the area of the supraorbital foramen and perform small circular motions. We will perform this until we feel a change in the tissue. After which, we will walk down with our thumbs down the lateral aspect of the nose, putting pressure medial with each thumb. Once complete here, we will then go to the infraorbital foramen and do small circles again. After change is palpated here, we proceed to the mental foramen with a similar technique. We now move back to the forehead for effleurage technique. Each effleurage stage is performed 5 to 7 times. Effleurage at first across the forehead and down the lateral sides of the face to promote drainage and to move the mucus out of the sinuses. Similar effleurage is performed across the maxillary sinuses from medial to lateral bilaterally. After this technique is finished here, we will then move down to the mandible and effleurage from the mental foramen laterally. We will then turn the patient's head, and you will run your thumb along the anterior cervical fascia from proximal to distal and then towards the clavicle. This is performed on both sides, with a reminder that each effleurage portion is to be repeated 5 to 7 times. Oftentimes, this sinus drainage technique is concluded with a suboccipital release or a cranial venous sinus technique.